Thank you. Welcome to the Dahlem Realty Podcast, where we explore the dynamic world of commercial real estate and the ever-evolving landscape of business today. I am your host, T. Gridge, and joining me today is one of the owners of Dahlem Realty, Charlie Dahlem, and our special guest, Mr. David Cook, the president and CEO of Hosparus Health. Gentlemen, how are we doing?
Doing well.
Doing great. Good morning.
David, let's start with you. Welcome. Thank you for being here. Do you mind sharing some of your background with our listeners and kind of how you got to where you are today?
Yeah, so that's kind of a fun story, actually. I started in banking and was still in college while I was working at a bank. Was there for 10 years, thought that banking was going to be the path for me, and worked for a lady at the bank who was near the end of her getting close to retirement, and so she retired, and I get a call from her, and she said, hey, I need help. I'm working as the director of hospice, and I need help. And I said, well, I don't even know what hospice is. She's like, just get down here. It'll be great. And so went down and met with her. I learned more about it. And that's kind of how I got into healthcare. Never planned to do that, but it's been a wonderful journey and a blessing to get to work in the space of hospice care, palliative care, and the like.
David, where'd you grow up?
So I actually grew up in the Louisville area on the sunny side in southern Indiana, here locally.
How about schooling?
So schooling, local too. So Indiana University for accounting, finance, and then a master's in business administration.
So did they seek you out because of your kind of being a numbers guy, because they felt like they needed somebody in that world, or how'd that work?
Yeah, I think that's where it started, was more from the business side of it, working in the billing department and kind of helping with that area. But quickly, I noticed that our staff, our nurses, and our social workers started coming up and asking questions.
Okay.
So I started reading regulations and policies and finding out what the answers were. And then after a while, more people started coming and asking questions.
Yeah.
And I think that's really how I shifted in from sort of this business office mindset to really operations.
Now, how long have you been with Hosparus Health?
So I've been with Hosparus Health twice. The first time was 15 years, and that was the journey where I started at one of our small offices in the business office. Ended up transitioning all the way up through a variety of roles over that 15 years to COO. Ended up leaving, going to North Carolina, was CEO of an organization very similar to Hosparus for a few years. And then when the opportunity came up to come back, I threw my hat in the ring, and we've been back now for 3 years. So a total of 18 years at Hosparus, and probably 24 in total in healthcare.
Awesome. Now, Charlie, I know Hosparus Health is a organization near and dear to you.
Yes.
Explain a little bit of your affiliation and how you got connected.
Well, I don't even know how many years ago it was, but the then CEO, Phil Marshall, came to me and leased 1,200 square feet in our office building.
Okay.
And over time, they took over a third of the entire office building.
Gotcha.
And at some point, Phil asked me to join the board, and I did. I knew everybody in the organization because it was like our office building was like a family. We had a bunch of tenants in there, but everybody knew each other. And I would hold the door for the nurses when they would come in, thinking, wonder where they just were.
Right.
Lord, really hold the door for her.
Yeah.
So anyway, I joined the board. Was on the board for I don't know 8 years or something like that. I can't even remember. I was the chair of a capital campaign that we raised $29 million.
That's pretty good
for the organization, and that's helping. It's helping feed many projects. I'll let David talk about some of the projects that it fed and what they're doing right now. But ultimately, I sold our office building to Hospice.
Okay.
And everybody had to move out. They kicked me out too, and I got and they now occupy the entire building. And that building, for those of you all who are in town, it's at the corner of Breckenridge and Dutchman's Lane.
Yeah.
It used to be the 1000 building. Now it's the Hosparus building.
Okay.
It's right there in healthcare, in the healthcare corner of the East End, really, with all the hospitals over there and all that. So, yeah.
Yeah, and really, that's kind of the way it works, Charlie. In nonprofit, we're always looking for someone to join that board that's community connected, community organized, that cares and has a passion for kind of what organizations are doing. And so when you see somebody like Charlie who has this huge heart and really cares, you want to get him on your board. And so it was no mistake that there was pressure get you on the board. And, well, I don't have to be kind. You can look at, it's the works, right? You can look at what you've done over the years and how much you've meant to this organization and to this community.
Thank you.
Well, Hospice, and then obviously the Catholic Education Foundation is an organization that Charlie supports big time. And I've heard Charlie say this, and Charlie, I'll let you maybe reiterate this, but you've kind of said, listen, it's my time. It's my time to give back. It's my time to do some good for the community. And I guess that's one of the driving factors, right?
Yeah, and I've said it before in a podcast. All of a sudden, like you look around and you see a lot of people around our community who've done so many great things, and many of them aren't with us today, right anymore. And you reach an age and you can look around and you go, oh, I guess it's my turn, right? and people need to do that.
So, David, explain to us now. Listen, when you use the word health, right, that could mean so many different things. There's so many different health companies. Now, Hospice is unique. Explain to us what Hospice does.
Yeah, so I'm going to talk specifically about the hospice care that we provide.
Got it.
As we talk about Hospice, and then there's some other areas.
Okay.
So hospice is pretty simple in concept. This is individuals who are facing a serious illness. They are in that kind of last 6 months of life, and facing kind of the challenges that we all face, not only just the patient with what does this mean? What are the things that are going to come?
Right.
How do I need to prepare for that?
Right.
But also the family and supporting the patient and the family along this journey to make sure that they get the best quality of life possible, and that we're connecting them to resources, support, and just helping them figure out how to make the best of the life that they have left.
Such a tough point in life, right? When you get to that point, when you have a loved one that's in a situation where they need that hospice care, man, I mean, having someone like you guys to turn to is almost, I mean, it's godsend, because what else would you do? And it's one of those things where it's a really tough job, really tough business, but thankful for what you guys do. David, do you have a personal story that maybe highlights the impact of the type of work you guys do?
Gosh, I mean, I hear stories all the time. We recently, a man was here with his daughter, pancreatic cancer, and really wanted to get back home, his friends and family one more time. And so we were able to help him get back to his home country. He was a motorcycle enthusiast, and his friends set up basically sort of this motorcade of motorcycles. He was able to, they outfitted a motorcycle so that he could be in the ride.
Okay.
Was able to be in that ride. They celebrated with food. It was a great time. And then we were able to bring him back and continue to support him throughout his journey. But it's there's the basic things that we do, right? I mean, people think, gosh, I don't know what to do. I need help. Or it's, mom or dad's in pain, or we need to figure out what the next step is because we can't care for mom at home any longer, and we don't know what that looks like. The part that people don't always see until they experience care is what our team can do to help that family. It's almost like you think of a hierarchy of needs, right? People come to us with a basic need a lot of times. It's like pain, or it's like shelter because dad can't live here any longer. What are we going to do? And they come to us with that basic need. Once we're able to meet that basic need, it's the higher level needs that are so valuable on top of that people don't often experience if they don't come into hospice care soon enough.
And it puts them in in a place where they can be a kid again with their loved one. I mean,
right.
They take the pressure off.
Don't have to be the caretaker.
You're not the caretaker anymore. You just got to be the husband. You got to be the wife. You got to be the kid, whatever.
Right.
Let's put you back in that role.
Yeah.
Right.
Now, Charlie, did you have any sort of experience? And obviously, you talked about the business side of this, and that's kind of you got connected. But what brought you into where you wanted to give so much?
Well, I learned so much about what Hosparus was doing just being around them all day, every day in our office building. And I had no idea that they provided grief counseling. They've got the inpatient care unit. They do something. They got palliative care.
Oh wow!
So it's not just the H word. It's a broad spectrum.
Gotcha.
of care that they offer our community and our region. It's not our community. It's the region. How many counties?
So 41 counties, 8 of those in southern Indiana and 33 throughout Kentucky. So Louisville, E-Town, all the way to Bowling Green, and then over to Madisonville.
So, I mean, that's incredible when you start thinking
big
about
reach.
Delivering care to all these rural communities. It's one thing to drive around Louisville, but I mean, think about that drive and what these people are doing, and all hours of the day and night.
Oh yeah,
right.
Absolutely, doesn't stop.
It doesn't stop. So that attracted me to it.
It makes perfect sense.
Yeah,
David, what are some of the misconceptions about hospice care that you encounter?
Well, some of the ones that I think we're always shocked to hear, but we still hear, are that hospice is one big national organization, and that's really hard to hear, because we know that there are differences in programs throughout the country.
Sure.
There are some programs that don't provide all of the services, don't provide all the support. And so, that's part of the reason a lot of people ask the question, why did you change the name from hospice to Hosparus so many years ago?
Right.
And it was to begin to differentiate between other organizations.
Gotcha.
So just the fact that there are different programs and that, there's Hosparus is your community focused. We've been here for 45 plus years, providing consistent care to anyone who needs support. So I think that's one big misconception. I think the other one is just the difficulty of bringing up hospice care.
Yep.
And too often we wait for everyone in the room to realize that mom needs hospice.
Okay.
And a lot of times mom's sitting there thinking, I really could use the support, and I know my loved ones need help.
Right.
But she doesn't want to bring it up because she doesn't want to send this message to the family that she's giving up.
Yeah.
And it's not giving up.
Okay.
There's that stigma that people believe, oh, this is giving up. And then the family sometimes doesn't want to raise the issue with mom because they're, we don't want mom to think that we don't love her and we don't want to support her.
Yeah.
And everybody in the room wants the same thing, but nobody's willing to talk about it. And that is, I think, one of the most difficult things that we face just nationally, is having the ability to have a conversation about what people want, what their choices are, and making sure that we're getting good care and good support to people when they need it, not just when it becomes obvious that they have to have it.
That's fascinating. So I really wouldn't have thought about that until you brought it up, but I've been in that situation. Is there resources, if now that you're giving that advice, makes perfect sense, right? Is there resources that families can go to get some information on how to broach the situation or how they should bring that up?
Well, I think one of the things just is to pick up the phone and call. And we've got some really solid, trained nurse and social work staff. We're happy to have a conversation about what that looks like. And one of the things I think that's really important too is we like to say a lot of times, just start services and see what you think. Mm-hmm. You can literally quit at any time.
Gotcha.
If you say, gosh, let's see what hospice care looks like, and you start seeing that support, if that's not a fit for you, you can leave at any time. Now, I don't think people are going to leave, but it's just sometimes we just need to hear, okay, well, I'm going to make this decision, and it feels so permanent.
Sure.
And it doesn't have to be. You can choose hospice. If you determine down the road it's not right for you, you can say, look, we don't want to do hospice any longer.
I was going to say that I was maybe 6 months ago, a friend of mine called me and said, look, my sister and I think that we need hospice care for our mom. Dad isn't so sure. Mm-hmm. And I said, Dad, will you talk to Charlie? He said, yeah, I'll talk to Charlie. Mm-hmm. So, my comment to him was, hey, you're a smart businessman. I mean, you need to collect all the data. That's what you do in any decision that you're making.
Yep.
Right? So why don't you just sit down and have a consult with them and see what it's all about.
There you go.
Just get the data points and make a decision. And they brought Hosparus in. She has since passed, and they said it was one of the best decisions they ever made.
Yeah, see,
they were really happy, but it was just get the data.
Yeah, find out, because even if you don't need it now,
right,
you know what hospice can provide, what support we can provide as an organization, and you'll know what the options are.
So, David, I'm going to ask a question here, because I think this is something that for people that maybe be younger or haven't been through this before are going to be curious. You mentioned a nonprofit. Charlie mentioned a large campaign that he chaired. What does the financial end of this thing look like? Does insurance cover any of this? Is it all out of pocket? What happens?
Yeah, so most of the time, individuals are going to be older. They're going to be Medicare or Medicaid, potentially, even if they're younger, and even commercial insurance. And pretty much everything is covered by Medicare. The only thing is, if you have like a doctor's visit, there would be a copay on that physician visit.
Sure.
Outside of that, everything's covered. And it's not just the care of the loved one, but the family can get grief counseling support. And we're really proud at Hosparus to be able to say we offer full spectrum support in grief and loss. So that goes for 13 months after someone passes, and it doesn't matter how long that individual was under our care. You get 13 months of grief counseling support. That can be individual counseling. Sometimes it's group. Sometimes it's even over the phone support, but that's available to you, and there's no additional charge for that coverage and support.
And they just built a beautiful grief counseling center. Mm-hmm. It's the Harshaw family Grief Counseling Center. Mm-hmm. The Harshaws put up the lead gift on that. Some of the $29 million that we raised went to build that, and it's a magnificent facility. It's peaceful. I mean, it's really a state-of-the-art facility. One step further, there was a young man who got killed tragically, and the family, I'd heard, was in a really bad place. The mom was in one place, the dad was in one place, the sister was in another place. And this is the kind of thing that can rip a family apart.
Oh, yeah.
Everybody's trying to, and I didn't know these people, but I knew somebody who did. And I said, hey, by the way, did you know that Hospice offers counseling, even though you didn't use their services?
Interesting.
You didn't use the Hospice services, but the grief counseling is available to this family with this tragic loss.
Okay.
And as I understand it, the family did engage Hospice, and they did go to the grief counseling, and as much as you can help somebody through a tragedy like that, it helped them move along and get to another place. So it's not just, yes, they offer grief counseling to the entire community. You don't have to use their services, right?
So grief counseling is available for anyone who had a loved one in hospice, but we also provide grief and loss support for folks in the community because, as you say, not everybody is passing through a hospice experience, and so we know people in the community are dealing with grief and loss for other situations.
Sure.
And so we offer that support as well.
That's fantastic. Now, Charlie, you just mentioned a state-of-the-art facility. You helped find a state-of-the-art facility in the E-Town area.
Right.
Let's talk a little bit about that.
Well, tell them about PACE, first of all.
Yeah, so this is...
Yeah, so the PACE program, right?
Yeah, this is really exciting, and a lot of folks in the country don't know about PACE because it's not offered in every state.
Okay.
PACE stand for?
PACE stands for Program of All-Inclusive Care for the Elderly.
Okay.
So it's this super cool concept and program, and think of it as a few things all put together under one package.
Mm-hmm.
So this is primarily for individuals who meet nursing home eligibility, but are trying to live at home with family.
Mm-hmm.
And so they need support to be able to do that.
Okay.
What PACE does is PACE becomes their primary coverage for all of their needs. So PACE takes responsibility for all of their care financially and for the coordination of that care. In addition to that, PACE offers transportation. So we have vans that are going to go out and pick up participants.
Wow.
They're going to take them to their doctor's appointments, dialysis 3 times.
How big of a deal is that, David? That seems like that's probably a huge deal for some people.
I mean, I'm just getting started. Like transportation is just one piece of this.
Got it.
So, but that alone is huge for a lot of folks. Being able to just have somebody pick them up with, the ability, whether it's wheelchair or whether, mom needs assistance, someone who understands how to do that and transport someone safely to and from their appointments. But we also, and Charlie helped us find this location in E-Town that has just really become this marvelous PACE center.
Awesome.
PACE, at the PACE Center, think of it as 3 different things. One, there's an adult day center. So participants who are in the community living with family, but somebody's got to go to work and mom's going to be home alone and maybe they're not comfortable with that, or maybe mom just needs some socialization. We're picking mom up in the morning and bringing her to the day center.
Cool.
So she's going to be at the day center. She's going to get breakfast, lunch, games. She's going to be there with other folks to socialize.
Awesome.
There are nurses, nurse aides that are in that day center supporting and working with those individuals all day. They're going to transport them back home. But also in that day center, there's another section of the building that is a full primary care office, just like you would walk into a doctor's office, fully set up, fully established, dedicated to the PACE participants.
Yeah.
So while they're there, if one of our staff notice, hey, something's going on with mom, let's get her back to the center. Right back, doctor can look at mom, assess what's going on, inform the family, and set a plan of care around that. So it's eyes on your loved one. Sometimes as non-clinicians, we don't always see things that nurses or physicians or nurse practitioners notice about a loved one. So we're doing that, coming in up to 5 days a week into the day center. The other portion of the building is restorative therapy. So helping individuals to continue to maintain their mobility so that they're stronger. So when they are moving around the house, falls are less likely. Anything that we can do to help them live sort of their best quality of life, all wrapped and bundled into this one program called PACE, which a lot of people are like, wow, that's a great idea. Why haven't we had this before? So Kentucky just brought it in and allowed this to happen. Charlie helped us find the location. We renovated this building. It looks amazing. People are like, wow, they can't believe this. And so it's in the E-Town area. We're covering 6 counties. So we cover Bullitt, LaRue, Nelson, Hardin, Grayson, and Hart counties. And we pick up participants in that area, bring them to the day center, get them to a doctor's appointment, and really work with them and the family to support them in the home as well.
Oh, cool.
And manage the totality of their care.
And so E-Town's tight. I mean, with the battery plant going on.
Oh, yeah. E-Town's exploding.
It's hard finding anything.
Sure.
And part of the deal was they needed to be able to get quick access to all of these counties. And this building is right off the expressway.
Yeah, it's right on the interstate.
You've seen
People
it.
probably know the building, right? It used to be
It used to be the Coca-Cola Museum.
Exactly. So if you know that area, you probably know that building.
Right. And but it's down a hill. It's in a nice quiet area. It's a nice quiet spot for these folks. But anyway, there was no sign on the building, and I just kept driving around. I kept going back to this building, and so we have a program that we use that we can look up properties and we can find data on the properties. And I found out that there was a bank downstate that had a mortgage on it, and I thought, well, maybe they've repossessed it. That's why there's no sign on it, whatever. So I called the lender, left a voicemail, and then some guy calls me out of Lexington and says, my lender just called and said that you were calling about this building. And there were 3 guys that owned the building, and they had plans for it. And long story short, negotiated a deal and wrestled it away for Hosparus. And I think it was it's just kind of main on what you told me you needed.
Yeah, it was perfect. And it wasn't for sale.
Yeah.
Right.
So you think we're looking at what are the options available.
Yeah.
And Charlie's out finding something that meets our needs that isn't even on the market.
Yeah, that's pretty awesome.
We end up closing a deal on it and building this incredible center that we're really thrilled to offer to Elizabethtown and all the surrounding communities.
And again, PACE stands for what? Again,
Program of All-Inclusive Care for the Elderly.
Okay, I just wanted you to say that again.
So, David, I'm sitting here thinking, and obviously I think people are going to relate this to personal experiences, and that's kind of what I'm doing. My grandmother, who lived to 101, just passed away here recently, and she was not going to leave her home. She was going to be in her home no matter what, right? But having a situation to where she could have gone somewhere, especially in those later years, to have some of that socialization, have some of those things when she couldn't care for herself, would have been unbelievable. And then the other thing, we didn't know how to get her in and out of her house. The transportation wasn't easy. There was all these different hurdles for us to kind of make that jump. She wasn't going to let us put her in a nursing home. It just wasn't going to happen. But this sounds like it could be the best of both worlds.
Yeah, it really is. A story that I recently heard, one of our new participants, really living at home, not able to get out much, told his family, I need you to take me out to get some new clothes so that I can wear those to the PACE Center.
Oh, how cool.
So, hadn't had a need to,
Right.
Really dress up. And
Yeah.
he's like, suddenly he needs new clothes to wear to the PACE Center. And
that's awesome.
That tells you we're making a difference in the lives of these individuals when they're so excited that they want to go out and get new clothes to wear to the PACE Center.
All right, so this segues kind of my next question here, David. So what role does the community play in supporting Hosparus Health's mission? What does the community need to do? How do we need to step up to help these awesome initiatives?
Yeah, so, we are the community in a sense.
Yeah.
You think about our organization, we're led by a volunteer board. Charlie's been part of that. These are individuals, they're not getting paid. They're involved in making sure that we're delivering on our promise and our mission to the community. And so, any dollars that come into that community are going back out to be used for the community. There's nobody owns Hosparus as a nonprofit.
Gotcha.
Individually. The community owns us.
That's awesome.
And so we are trying to deliver as much as we can, and that's why we've really been on this program of expanding support and services to our community. It's why we built a new grief counseling center, because people deserve a nice, peaceful place to go when they're grieving and dealing with that. It's why we brought in a PACE center. It's a completely different type of care that Kentucky really didn't have. And so opening that PACE center, delivering another type of care. It's why we've expanded into palliative care. And if I can for a moment, just to give you a sense, we've been around for 45 plus years. And when hospice started, it sounds kind of crazy, but healthcare was really pretty different, right? So people called and mom had a single condition. She had heart disease. And so we'd care for her based on heart disease. And years ago, mom would pass away from heart disease. But now there are all kinds of treatments, medications and ways that we can allow mom to live longer with heart disease. And what we're seeing is that individuals who are living longer with heart disease are living longer, and they're actually having other issues. So we're finding the complexity of patients that are reaching out, getting more and more complex.
Okay.
Not everybody fits in a hospice box.
Yep.
They're not in that. You used to see severing with individuals in that last 6 months, and that's where we were supporting the individual and the family. Now we see individuals who are living with chronic and serious conditions well beyond 6 months, years, and they still need support. And sometimes, I'm sure you've all been in that situation where you have gone through something and then you find out some key piece of information and you're like, well, that would have been nice to have known 6 months ago or 2 years ago. Like, that would have changed our entire life.
Absolutely.
We're able to come in and do what isn't going to happen in a typical physician's office. The average time in a physician's office is 7 minutes. So even if you go with your family member, your mom, your dad, to that doctor's office, you really don't get to understand what's going on, right? You don't get to ask all the questions. And sometimes it's so fast and you're hearing information. You get out to the car and you're like, crap, I should have asked this. Right. Palliative care is bringing a provider to your home, sitting down with you and helping you understand, what does it mean to have COPD?
Yep.
And what can I do to avoid some of the negative consequences of COPD? And so being able to sit down, educate the patient, educate the family about the disease and what that looks like, and then put strategies in place to avoid unnecessary trips to the hospital. I don't know too many people who like going to the hospital. And so if we can help them understand these medications, looking at medications, that's another huge thing, right? We go to several specialists and doctors, and we'd love to think healthcare is coordinated, but it's not. And so you get different medications for the same purpose, and now you're exhausted and you don't feel well, and you're thinking, why am I so tired? Because you're taking two medicines for the same purpose that were prescribed by different doctors. We look at all of your medicines, make sure that we understand the complexity of those meds, that we're working through and getting a good plan of care. And those things, unfortunately, don't happen naturally in the traditional healthcare system. So palliative care is coming out for those who are far beyond the hospice space and supporting and providing care and education around care so much earlier.
Charlie, I'll let you chime in on this after I say this, but David, this is a not an easy topic to talk about, right? Kind of a little bit morbid in a sense, but the way you approach this with so much enthusiasm, and it really seems like you, being the CEO and president, really care about this, and you really care about what Hosparus is doing. And to me, it really gives me a sense of calm and a sense of, man, if I'm in that situation, I feel like I'm going to be in really good hands there. Do you feel the same way there, Charlie?
Absolutely. I mean, you're just talking to David. You don't know the other people in the organization.
Right, absolutely.
I do.
And they're way better than I am.
Though, there is a huge level of enthusiasm top to bottom in the organization. And I think, if let's just talk about the nurses. It takes a special person to go out and deliver this health care.
Absolutely.
It takes a really special, day in, day out. A lot of times the people that you're getting to know, they're not with us long, and that's tough. But they do a great job. Dr. Snyder, their head physician. I mean, she is sharp as a tack and is fully committed to what she's doing, and making sure that her team, the medical team, is as good as it can be. And she's available all the time. She's amazing. And I bring up her. I mean, you go top to bottom in the organization. Tawanda Owsley is head of development for them. She's raising the money, but she knows what she's raising it for. We're trying to build a I say we. We're trying to build.
That's right. We.
Is it still we? Yeah, it is we. Okay. Trying to build an inpatient unit right now. That's some of the money that we're trying to raise right now. The inpatient unit's really, really important. Not everybody gets to stay at home because they need another level of service. And to have a beautiful inpatient unit that can look as much like home as you can get and be able to deliver the services at the end of life is really important. We've got the land. We're raising the money for it right now, right?
Absolutely.
And hopefully next year, 2025, break ground on it.
Yeah, and some people may be thinking, well, I thought you had an inpatient care center, and we do.
Right.
Fortunately and unfortunately, we provide some amazing care in a less than ideal situation.
Sure.
So I think people sometimes go into the space, and we do such a good job of managing care and supporting them that they don't know the problems that we face.
Right.
So literally rooms, just because of the age of the facility, heat and air are sometimes difficult. Windows are older in the building. They leak. Rooms are small. And what our community deserves and other communities have is the ability to go to a facility, park, and walk in. Not have to figure out where the parking garage is, and then how do I get to the facility from the parking garage.
That's a great point.
And to then have actually the physical space to stay with your loved one. And, you know, we're at times where it's like you can only have so many people in the room at the time because they're so small. And allowing a larger family to come and be around a loved one and to be able to stay and have support and have space where they can go out and talk, and areas for kids.
Sure.
Because sometimes we just need, you know, an area for kids to play so that we can have more serious conversations and support. And that's really difficult in the space. We, the new facility would have a much larger family kitchen for people to be able to eat, dine, have food available. Right now, it is literally like a closet that we're trying to work out of.
Got it.
We have one shower in that entire unit right now.
Oh, wow.
So this new facility will have a shower in every room. So the complexity of delivering excellent care is harder than it should be, and the experience for our community is harder than it should be. And we can do better in Louisville, and we're really excited the vision of being able to deliver this. And, you know, you may be hearing this podcast right now and thinking, I don't need that.
Right.
But that's the way it works.
Oh, yeah.
We don't know when we're going to need it. And, you know, we're driving along 1 minute and the next minute we're in a situation where we're looking for that kind of support. And I want that facility to be there for you when you need it.
Man, that's powerful.
It's going to be amazing, and it's going to be located right off of the Waterston Expressway at Taylorsville Road, if you know the region.
Sure.
It's right in there.
What a great location, very centrally located.
Yeah, it's great access from Waterston 64. I mean, for the whole region. I mean, this is for the whole region.
TARC availability, so individuals who might not have access to a car can get
right on a TARC line. Man, that's fantastic, David. So, listen, this has been awesome. Is there anything else, David, Charlie, we want to mention that we haven't talked about yet? Is there anything else you guys want to hit on?
I think we've hit on most of it.
I would just add that we are still fundraising for this inpatient care center. And so if you're also hearing this podcast and you've got the ability to support that, we'd appreciate.
How would one do so?
Yeah, so you can just go to our website and reach out to our organization. You can call us and ask to speak to Tawanda Owsley. There's also naming opportunities if you've got a loved one. Maybe you were cared for by our organization and you're looking for a way to just honor and respect their life. This is a great opportunity to be able to name a room or a part of that building after your loved one.
It's pretty awesome. Charlie, this was a great podcast. I'm so glad you were able to get David on. It really opened my eyes to some things that I had never really known even existed.
Right.
And I'd gone through this with some family members, but man, I tell you, hearing this, and if I would have heard this podcast kind of, earlier in my life before I went through some of these things, I think I would have had a different look and different outlook on some of these things.
A lot of people just don't know. You were asking me, why did I get involved? It's because we got to get the word out.
Yeah.
It's not just end of life care. It's the continuum. There's a much bigger picture on what they're delivering and what David and his organization are delivering.
David, thank you for doing what you do, man. It's pretty awesome stuff. And, it's thank you for coming on and sharing this message. And hopefully some people listen and have a different view or a different outlook on what they might be able to do for a loved one's healthcare. Yeah,
don't be scared to call. You're going to be met by some of the most compassionate, loving people. My job's easy because our team's amazing.
I love it. Well, thank you, ladies and gentlemen, for listening to the Dahlem Realty Podcast. Hit that subscribe button or give us a 5-star rating if you don't mind or you like our subject matter. And we'll be back next month with another engaging guest.